All right, let's now get more on this, and we welcome, as always, Professor Adrian Puren, who is the Acting Executive Director for the National Institute for Communicable Diseases, to weigh in on the significantly rising COVID-19 cases in the country. A very good afternoon to you, Prof. Puren. Always a pleasure to see you here on SABC News, sir.
Yeah, thank you very much for the opportunity. Yes, so we are in a resurgence, and I think that this was predicted.
Yeah.
I think the nature of this resurgence, I think, still needs to unfold. But yes, you're quite right. We are certainly seeing a marked increase in cases. But I think we just need to be cautious that it may not be reflected in all the cases, given that the testing patterns here are somewhat different.
Yeah.
They're not to the same extent as we've seen in previous resurgences. So it may well be higher than what we are actually reporting. But importantly, as you've already noted, in terms of deaths and also hospitalizations, we're not seeing a marked increase. I know they're lag indicators, but we're not seeing marked changes with regard to mortality as well as hospitalizations.
Prof, you talk about the testing patterns being different. Can you just explain to us in layman's terms really what exactly you mean by that?
Yeah, so in other words, when we look at testing patterns with regard to how the public access testing and the nature and extent of that testing, we see very often very dramatic increases in testing. But this particular phase, this initial part of this resurgence, we've not seen a really dramatic increase. We're starting to see that. So in other words, the level of testing is not as we would like to see it if we were to be under ideal circumstances. But I think it's what we've come to expect, I think, worldwide. You know, people are probably experiencing symptoms of COVID or influenza, for example, and deciding not to test. However, we would encourage people who are experiencing specific difficulties and severe symptoms that, in fact, they do go to hospital and they do test. So that's the main point that I'm trying to raise. But nevertheless, given that, I think what is critical is that there is what appears to be similar to the previous resurgence, an uncoupling of cases versus hospitalizations and deaths.
Yeah, one of the issues, and I wonder if it might have been concerning to you as medical practitioners, is the fact that, you know, some of the regulations were and have been relaxed. I mean, one of them being that, you know, if you're outdoors, for example, you don't have to wear a mask. And it begs the question of whether or not, you know, this is adding to the numbers that we're seeing at this time. And if that is possibly a sort of criticism to government for you know, kind of relaxing some of those regulations that we had gotten used to, and as I say, does it then add to those numbers?
I don't think not necessarily so. I think you've seen us come through the previous resurgence with a level one in terms of the adjusted risk. So I think we are in a similar situation, really. But you're quite right. There may have been additional relaxation in persons not wearing their masks under particular conditions. But I think you're quite right. I think we still need to emphasize that where there is risk, and for example, in closed, confined spaces that are poorly ventilated, again, we would certainly recommend the wearing of masks and physical distancing. And again, the risks outdoors, I think I think it is an important consideration that it is safer in the main. But again, if you're in a situation where there's going to be close contact with individuals, even though it's in the outdoors, I think you may well take the individual choice and actually wear a mask. But I think also really critically is really to try and get our vaccine figures up. Yeah. I think that's really going to be important, other than the MPIs. I think really in order to ensure that people don't end up in hospitals, don't overwhelm hospitals, because it's still a severe disease. We should not kid ourselves. I think it's really important that people do become vaccinated, because the likelihood is that people who will end up in our wards, in our ICUs, are people who have not been vaccinated to a larger extent than those who've been vaccinated, at least at this particular point.
Prof, is there a way to measure, you know, or tell how the vaccines that have been taken so far have assisted? I mean, if we're still hearing about these numbers being so high, and we're still having the same concerns that we had when the pandemic started, then one asks, you know, how has the vaccine then helped while you're speaking about the vaccine?
That's a wonderful question, and an important public health question, and an important question for the public as well, is what we call or measuring the effectiveness of the vaccines, the vaccine effectiveness studies. And I think we need to realize that the vaccines were not necessarily designed to prevent infections. They're really designed around preventing hospitalizations and death. So there are ways in where we can link up our patient data and the vaccine data and the specific study designs. I won't go into the complexities of that then can allow us to say, well, when we look at the vaccine effectiveness in terms of preventing hospitalizations and death, this is the extent of prevention. Yeah. We can certainly do that for symptomatic disease, but I think that there's interest in that, obviously. But I think the main focus in terms of effectiveness is really around vaccine effectiveness studies. Yes.
Yeah, Prof. I'll just say, as I report on, the deaths that we every day we look at the deaths that that have been reported every 24 to 48 hours, here on SABC News, and I must say, being the person, one of the people that come in and say those numbers, I have noticed a significant decrease in the numbers from the time that the pandemic hit us, and of course since last year, and now it's not as many numbers. Is there any link to what we had been hearing and what we had been talking about, when we first heard of the vaccine, the herd immunity that had been spoken about? Is there any link to that, the fact that we're hearing of less fatalities, less deaths linked to COVID-19?
I think that is partly correct, and I think we've also been fortunate with regard to, at this particular point at least, with regard to the variant of concern that is in circulation. So it's still Omicron, but it's certainly the sublineages. So when some of the initial studies in terms of the immune responses certainly would show that you can certainly be reinfected, and that if you vaccinated, you can still become reinfected and present with symptomatic disease, but that you will likely be protected against severe disease. And therefore, what we're seeing really is that the severity of cases is likely most likely in unvaccinated, but you will have some individuals who are vaccinated who will still end up in our wards. But it's really different. I think things could change. I don't think the variations in this particular virus have been exhausted necessarily, but let's see what will happen. It's difficult to predict.
All right, Prof, it's always a pleasure to have you on your show, and thanks always for your input.